You open up that cycle tracker on your phone and you look at it and it says you ovulated on day 14 and you're like, yes, but day 28 has come and your period is still not here. You look at that tracker and you're wondering, what in the world is going on with my cycle? Why do I not have my period? It says I should have my period. 1 month your period maybe shows up when you expect it. The next month it's completely gone. You skip between cycles, you're peeing on ovulation strips, and you have no clear answer. And you are just really stuck wondering, can I even get pregnant if my cycle is all over the place? You go to your provider and you tell them, hey, my cycles range from 28 days to 35 days. And they say, that's normal. It's within range. And now you just feel like you don't know what to do. Your body doesn't feel normal, but you're being told it is. And now you're starting to wonder if you can even get pregnant. So let me reassure you right now. Yes, you can get pregnant with irregular cycles. We're going to unpack how you can do that, how you can regulate cycles, and what an irregular cycle could mean for your body.
God designed your body for fertility, but when the journey to parenthood feels like a heartbreaking mystery, it's so easy to feel lost. I'm Dr. Trisha, a nurse practitioner and fertility consultant who's been where you are. That's why I created Fertility by Design, where faith meets science to empower you with real solutions, holistic healing, and biblical encouragement. You are not alone. Your fertility is not broken. So let's walk this journey together.
Welcome back to another episode of Fertility by Design. I am so glad you're here. This week, we had a huge client win come in. I had a client reach out to me. She had some follow-up labs. Previously, her AMH was 0.266. She had a lot of inflammation going on in her body when we met. And unfortunately, for years, she had been told that everything was normal. Once we really started targeting things, she started to feel so much better. She had a recheck of her AMH, guys. Her recheck AMH came back 0.94 from 0.266 to 0.94. You know, that number that everyone tells you, you can't improve that. It just is what it is. No, we know inflammation can lower it. And this was such a beautiful, perfect example. So we are praying and standing in faith that this means something so big for her and helps her make decisions on her next steps towards creating her family. Today, we are going to dive all into irregular cycles and just kind of touch the surface on some reasons why we can have irregular cycles beyond just the most common reason we hear, which is PCOS. We're going to talk not just about PCOS, but we are going to talk about how the thyroid, inflammation, and stress can affect our cycle as well. But the first thing I want to talk about is that irregular cycles don't just make it hard to get pregnant. I hear and see so often on Facebook groups and forums and things like that of, well, I had PCOS, but I'm not trying to conceive, so it doesn't matter. And the truth is yeah, it still does, because we know PCOS is linked to other morbidity, other disease processes later on in life, like diabetes and heart disease. And so it really does matter. Your cycle is not just about making it easier to get pregnant or about getting pregnant. It's actually a vital sign of your overall health. It's really that extra vital sign that no one's paying attention to, that no one is taught to understand. So that's what we're doing here, guys. All right. So if you have irregular or missing periods, that does not equal fertility treatments. Okay. That equals investigating further to determine, why are my cycles irregular? I'll hear, oh, my cycle is 28 days, 1 month, but then it's 35 the next. And that's still in that normal range from 21 to 35. So I'm good. But really, no, that's where people get hung up and misunderstood about irregular cycles. Just because it falls in 21 to 35 days doesn't mean that 21 days 1 month and 35 days the next month is considered normal. It's not. There's too much variability there for you. Your variability should only differ plus or minus 1 to 2 days. That's it. So if your cycles, even if they fall in the normal range of 21 to 35 days, if you are at either end of those spectrums at any given month out of the year, that's not normal. And so we need to investigate that. But again, too often women are just dismissed because, oh, you just need to lose weight, or, oh, that's normal, or just keep trying for a year. And there's so much ignorance, honestly, in that, because you'll unnecessarily be waiting a year when you already know there's an issue. So I can't say this widely spread enough that irregular cycles warrant an investigation long before a year. Long before a year. If you knew you were having any sort of issue, health issue, for a certain amount of time, it's the same. Like, would you go to your doctor and tell them that you're having stomach pain for the past 3 months and them tell you that you need to wait a year? That would be crazy, right? Although who knows, like that probably happens too. But it's no different with your irregular cycles. If we know that there's an issue now, it doesn't make sense not to work it up. So use that to empower yourself first and foremost when you go to a provider, and stand your ground, but also know that you're not met at a dead end if traditional medicine has nothing else to offer you besides medication. I'm going to share one of my client stories actually, because she was struggling with PCOS and irregular cycles for years. Some failed fertility treatments, was diagnosed with PCOS, but was told just to lose weight, eat less, work out more, and come back when she had lost the weight. And that was it. No plan. She'd tried to lose weight. She was trying all the things that she knew how to try based on media and low fat and this and that. And it just wasn't working for her. She just had this vague suggestion that left her really discouraged and stuck where she was. When she came to us, we were able to see her functional testing and the way that it was impacting her cycle and her body. We saw blood sugar dysregulation. We saw some thyroid imbalances. We saw high levels of inflammation. We saw some gut things that we needed to address. And once we really targeted her nutrition and her supplements, according to what we found going on in her labs, her cycles began to regulate. And by month 3, she was pregnant. And now she is holding that baby boy very close and still sending me messages about how thankful she is God intervened on her journey when she felt so stuck. So as we dive into 4 of the most common root causes of irregular cycles, yes, PCOS, of course, is the one we've heard of the most, okay? We can have some signs of PCOS. Is going to be those longer cycles, missed periods, going months without a cycle. With PCOS, we can see those high testosterone symptoms like acne, hair growth on the face especially. We can see that central obesity in the abdomen. We can see hair thinning similar to male pattern baldness. We'll see those long and irregular cycles or missed periods completely, not having a cycle at all. We will see insulin resistance, high blood sugar, maybe a high A1C, things like that on lab testing. When we do ultrasound, you can see a lot of follicles on the ovaries, and it looks like a string of pearls. And so that's one of the actual diagnostic criteria for PCOS. We'll dig deeper into all of this in an episode dedicated just for PCOS because it deserves its own episode. But what can we do to help PCOS? Well, first and foremost, the biggest thing is going to be balancing the blood sugar through whole foods, focusing our meals around protein, healthy fat, and fiber. Inositol supplements, berberine, those are going to be very helpful. They have been shown to be very helpful in helping control insulin resistance and regulating the cycle. Strength training is actually really great for PCOS, and even HIIT training in short intervals has been shown to be effective for women struggling with PCOS. And of course, focusing on what's going on under the surface, what could be causing inflammation, and what could be driving some of this hormonal chaos. Thyroid dysfunction can also affect our cycles. If we are not absorbing nutrients well, if we are under eating, if we are not supporting our body the way it needs, we can see our cycles disappear. We can see cycle irregularity. We can see our hormones plummet. Some signs of thyroid dysfunction can be fatigue, cold hands and feet, thinning hair. That's going to be more on the hypothyroidism side. We can also see like nervousness, anxiety, just really wired. And that can be on the other side, the hyperthyroidism side. We can also see a history of miscarriage with thyroid disorders too. We know that when it comes to the thyroid and looking at blood levels like TSH, the research shows us that optimal levels for fertility and for pregnancy are 2.5 or less for the TSH. Oftentimes, if we are above this, level, we can see an increased risk of miscarriage. We can also see an increased risk of miscarriage tied to TPO antibodies being present, which is autoimmune activity going on, even despite normal TSH levels. So that's very interesting because many times in traditional medicine, we don't even see TPO antibodies checked when someone is struggling to conceive. So that's really important to advocate for, that you get a full thyroid panel, not just a TSH, if you are struggling to conceive, especially if you have a history of recurrent miscarriage. Also, nutrients like selenium, iodine, zinc are very, very important to help support the thyroid. And then, of course, supporting the gut and immune system, making sure that we can even absorb those nutrients in the first place. Chronic inflammation is also going to disrupt that brain and ovary connection and could prevent ovulation altogether. Vague signs like bloating or IBS symptoms, skin flares, joint pain, that eczema that keeps popping up, mood swings like anxiety or brain fog, all those things can be signs that there's a deeper problem, especially in the gut, right? So gut testing can be really important here, focusing on a lower inflammatory diet like colorful veggies, lots of healthy fats, lots of good clean proteins. And then, of course, removing refined sugars and seed oils are going to help drive down that inflammatory load as well. Oftentimes, this is where we see a gluten-free diet or a dairy-free diet really help drive down inflammation as well. Initially, it's not a long-term fix, right? Really, we got to focus on what's going on in the gut. Let's heal the gut lining, and then we can tolerate those things again. The problem becomes when those things are going through and into our extraintestinal system where they're not supposed to go. I've heard many people say, oh, I have to live on the AIP diet, but I can't do that. And they're like, no, duh, you can't do that. It's really restrictive. Can't do that for the long term, or you don't want to do that for the long term. It's not the actual root cause fix. The other thing that can really affect ovulation and therefore affect the regularity of our cycles is HPA axis dysregulation, our stress response. So there's the HPA, the hypothalamus pituitary adrenal axis, and they got to talk to each other for the hormones and our stress response. But there's also the HPO, hypothalamus pituitary ovarian axis. And of course, everything's very interconnected. And so if we're experiencing chronic stress, which who isn't in this world right now, high acute stress, some sort of traumatic situation, our body tells us it's not safe to reproduce. Also, if we're not fueling our body, if we are inadvertently under eating, overtraining, things like that, it shuts our body down and says, it's not time, it's not safe to reproduce in this moment. So we're just going to shut down ovulation. And signs, of course, will be irregular cycles, not ovulating, not getting a period, or you could have a short luteal phase, some spotting before your period, mood swings, low libido, sleep issues, anxiety, and just that feeling of burnt out. We need, in this situation, to give the nervous system a lot of love and tender care. We need to teach ourselves to be able to feel safe. We need to prioritize sleep. We need to eat, bump up our carbohydrate intake here, make sure we're fueling our body with the nutrients it needs, make sure our gut is absorbing. You see the common thread here? The gut is always involved no matter what, guys. Making sure we're absorbing our nutrients adequately, leaning into a lot of prayer, journaling, maybe therapy, things that can also help regulate, some supplements that can help regulate those cortisol levels are going to be like ashwagandha, magnesium. We can use holy basil, L-theanine, lemon balm, things like that to help calm our nervous system as well, and really just slowing down. I always tell my clients who are struggling with cortisol issues is that there's no magic supplement that is going to fix things the way that really honing in on the lifestyle pieces that need to change. There has to be some sort of change when it comes to dysregulated cortisol in the lifestyle. You can't out supplement it. It's going to chase you down. So another good example is one of my HA clients, hypothalamic amenorrhea. We saw she was actually still having cycles by the grace of God. How, I'm not sure, because her hormones were literally pretty much undetectable and nothing was looking the way it was supposed to. And her body was really just kind of in survival mode after years of inadvertently under eating and dieting and some stress responses that was happening. So we really slowed down. We focused her workouts more on doing them and getting them done than the performance of them and using them as the stress relief that they were to her, but without stressing her body too much. So shifting from runs to walks, We took her strength training from these longer workouts to more focused each session, shorter focused sessions. We focused on not looking at food as good or bad and having more balance and nourishing the body with good complex carbs, but also having room for things like ice cream and bread, things that she hadn't really allowed herself to enjoy much over the past few years. We have been supporting her nervous system and trying to give her body the cues that it is safe to procreate, and really just tracking labs along the way. And we just got back her recheck labs, and her FSH and her LH have come so far already just in the past few months into optimal levels just by this focus support. So it really makes a difference when we take a strategic, targeted approach based on what you have going on. Because when we just look at irregular cycles, it can be a blanket, right? We just assume maybe we have PCOS, but it can be so much more going on under the surface. And what do those things really mean? And when we take a targeted approach with lab testing, we look at functional testing, it really gives us clearer insight to exactly what is going on with your body. So we're not just doing Band-Aid approaches. So hopefully you feel a lot more empowered now when you are trying to navigate this all on your own, when you're going to your provider and requesting testing, or maybe you're trying to take that next step. Use this episode to empower you. You can ask the questions. You have this innate knowledge of your body that no one else has. So you don't need to take blanket, traditional, wait a year approach. It really can be time to dive deeper sooner, especially if you are experiencing irregular cycles. Thank you so much for listening to today's episode. If this episode has blessed you, share it with a friend, leave us a review. It helps us reach more people. If you listen to this episode and you're like, I actually think I'm ready to dive deeper and to get some clear answers and a clear path forward, please reach out to us, book a consult below. We would love to chat with you and connect. If you're just looking for more support and you just want a like-minded community filled with all the faith and fertility advice, then join our Faith and Fertility Circle. We would love to have you and see you there.
That's it for today's episode of Fertility by Design. Subscribe so you never miss an episode, leave a review to help more couples find hope, and share this with a friend who needs encouragement on their fertility journey. Need even more support? Let's connect. Find me on Instagram at Trisha Zehrung for faith-filled fertility guidance, real solutions, and a community that just understands. Remember, your fertility is not broken. Your body is beautifully and wonderfully designed, and God's plan is always perfect. I'll see you next time.